7.0 Objectives. After going through this practical, you will be able to plan for a home visit. Prepare a list of equipment needed for a home visit. Prepare the community bag with the necessary equipment for conducting the home visit. Conduct the home visit effectively. Identify family health problems. Make family care plan based on identified problems. Carry out nursing procedures and provide nursing care as per plan. Follow the nursing principles while using community bag for carrying out procedures in home. Record home visit. Evaluate nursing care and plan next home visit. 7.1 Introduction. Home visiting is an important responsibility of a community health nurse and health worker. It gives an accurate assessment of the family structure and behavior in the natural environment. It also provides opportunities to observe the home environment and to identify barriers and support for reaching family health promotion goods. Health services in the home requires technical skills, knowledge of preventive and therapeutic measures, teaching ability, judgment, and a full understanding of human relations. Healthcare begins at home. In order to help people to overcome their health problems and guide them to cope with their nursing problems, healthcare services in the home are provided through home visiting. A community health nurse working in a health in providing family health care services. To fulfill this responsibility, she must have confidence in herself, helping attitude and values to assist the health worker in identifying the needs of the families, plan health care activities for home visiting, supervise and evaluate the care rendered by the health team members in the home environment. In this practical, you will learn how to plan and conduct a home visit. 7.2 Home visiting. Visiting homes is one of the best methods to know the family. During the home visit, community health nurse, multipurpose health worker can provide care to family members or supervise care being given by the family members to the sick and disabled. She will be able to conduct, assist, supervisor care provided at home, thereby help family members to resolve the problem encountered by them. She will also be able to identify early signs of anemia, tuberculosis, leprosy, cancer and a host of other diseases, demonstrate some procedure or skill to the family for the rehabilitations of the sick person and achieve 100% immunization of the children in the family and in the neighborhood. Home visiting helps to establish a rapport with family and health workers become their friend, guide and counselor. 7.2.1 Definition and Objectives. Definition: home visit is purposeful and deliberate psychosocial activity undertaken by the health team members for meeting the diagnostic and therapeutic needs of the family. The main objectives of home visit are to obtain first-hand information for family assessment, to get acquainted with the family health needs, to begin working relationship of continuing assistance in promoting family health and resolve health-related needs. 7.2.2 Purposes of home siting. It is a routine part of a planned visiting program by community health personnel. It helps to investigate the source of infectious diseases, to follow up for some problems identified in the health center, school, industry or hospital, to assess the nutritional and immunization status of children, to give health education to the individual, family and community, to supervise and guide other health workers. 7.2.3 Principles of home siting. Need-based. Home visiting should be planned and conducted based on the identified needs of the people. Priority-based. The home visit should give to the existing problem in the family. It may be maternal and child health services or antenatal checkup. Regularity. Plan for regular home visiting programs based on family needs. It should be conducted at regular intervals. Flexibility. The community health nurse should adopt a flexible approach based on prevailing circumstances at home. Scientific-based. Be sure of the scientific soundness of the subjects used for discussion. Use of technical skills includes hand washing and inspection. Analysis-based. Collect facts about the home, the patient and the environment, and make an objective analysis of the facts as an initial step in visiting the home. Developing relationship. Work with the person and family plan jointly. Home visiting helps to establish good working relationship in the family. Sensitivity. The community health nurse should be sensitive to the person's feeling and needs at the time of the visit. Listen to the family and understand the other person's point of view. Educative, evaluate your own work. Remember, the quality of care is more important than the number of home visits. It is essential to evaluate home visits from time to time. 7.2.4 points to a member for conducting a home visit. The community health nurse should consider the following while making a visit to family, such as physical and environmental status of the family and location of family in the community, cultural background of the family. This helps the community health nurse to understand the family's attitudes, beliefs, and practices regarding health care, occupation, and income of the family members to determine and assist in financial problems, age of the family members, educational background of the family members, psychological factors. Home visits must be planned. It should be planned with a purpose to provide care, assisting in difficult situations to overcome and cope with the difficulties. It should be acceptable to the family members and not be coercive. Use home visit as opportunity to teach the family members on different health aspects. Be flexible to offer help besides the purpose of your visit. Have a timetable for visiting particular houses based on high-risk approach. 7.3 Steps in home visiting. Planning before a home visit. 1. Have name, address, and telephone number of the family, with directions and a map. 2. Clarify the purpose of home visit, e.g., postpartum visit. 3. Have a plan of activities for the home visit time. 4. Have community bag carrying all the equipment needed for home care. 5. Have information and teaching aids for health teaching, as appropriate. 6. Have information about community resources, as appropriate. 7. Collect information about the family and individual from family folders, clinical and other records. 8. Just before the visit, check that all required equipment such as community health nursing bag, family folders, unused, blank health cards, teaching aids, materials for demonstrations are adequately carried. Phases of home visit. 7.3.1 Initiation phase of home visit. 1. Knock on door and stand where you can be observed. 2. Identify self as name, introduce yourself to persons who are present and acknowledge them. 3. Introduce yourself to the family in a friendly manner. State the purpose of the visit. 4. Observe environment. 5. Sit where family directs you to sit. 6. Talk in a language understandable to family members. 7. Initiate working relationship with family members. 8. Discuss purpose of visit and discuss services to be provided. 7.3.2 Implementation phase of home visit. 1. Complete health assessment by observation, questioning and assessment. 2. Assess for changes since the last encounter. 3. Explore the degree that family was able to follow up on plans from previous visit. Explore barriers if follow-up did not occur. 4. Encourage the family to talk more about themselves, their women, concerns, and difficulties, problems. 5. Maintain trust and confidence of the collected information. 6. Avoid asking sensitive questions in front of others. 7. Collect all relevant information. 8. Be sensitive to the habits and culture of the family. Avoid criticizing the family. 9. Teach and demonstrate the new skill or the skill which needs to be strengthened by the health worker. 10. Do not criticize the health worker or the family members for not following the advice given by you during the previous visit. 11. Be flexible in your approach to family care. Alter your plans as per their needs. 12. Wash hands before and after conducting any physical assessment and direct physical care. 13. Conduct physical assessment, as appropriate, and perform direct physical care. 14. Identify household members and their health needs, use of community resources, and environmental hazards. 15. Explore values, preferences, and clients' perceptions of needs and concerns. 16. Perform nursing care procedures as per need of the family. 17. Conduct health teaching as appropriate, and provide written instructions. 18. Provide comfort and counseling, as needed. 19. Discuss any referral, collaboration, or consultation. 7.3.3 ERMINATION phase of home visit. 1. Summarize accomplishments of visit. 2. Clarify family's plan of care related to potential health emergency, appropriate to health problems. 3. Discuss plan for next home visit and discuss activities to be accomplished. in the interim by the community, public health nurse, individual client, and family members. 4. Record the visit in family folder or daily diary. 7.4 Articles, equipments required for home visit. Community health nursing bag. Family folder consisting of individual cards. Health education materials. Additional equipment and supplies as per the procedures to be performed, e.g., immunization kit. 7.4.1 Community bag. The community health nurse requires some tools and instruments for doing procedures during home visits. The purpose of community bag is to carry out nursing procedures in home, which includes weighing the children, performing minor dressing etc. The bag is made of strong material, e.g., cotton, leather, or any strong material. The bag has lining outside and inside with pockets. It has 2 outside pockets with washable lining and 1 inner pocket. Articles used in community bag. Outside pocket. Newspaper, stationeries, family folders, flashcards and waste paper bag. Side flap. Tablets containers should have paracetamol, Septrin, multivitamin or B complex, anti-inflammatory, etc. Solutions antiseptic, Savlon, betadine. Benedict solution, acetic acid, methylated spirit and eye drops or ointment. As per standing instruction. Lower compartment, urine analysis kit, specimen bottle, kidney tray, test tubes holder, spirit lamp and matchbox. The hand washing. Items soap, towel, nail brush, small Macintosh or plastic sheet and plastic aprons. Physical assessment instruments, fetoscope, stethoscope, inch tape, Shakir tape and spring balance to check weight. Sterile compartment, instruments, artery forceps, thumb forceps, small towel and scissors. A pair of disposable glove or paper gloves. Miscellaneous articles, mucus suckers, talquest paper for checking hemoglobin and small catheter. Contents of outer pocket 1. Daily diary, family folder. Newspaper, flashcards and waste paper bag. Contents of outer pocket 2. Soap and soap dish, nail brush, hand towel, disposable paper bags. Contents of inner pocket. Spring balance. Tape measure. Oceans, Edisons for external use, as per standing instructions of state. I. Gentian violet, 1 bottle. E. Methyl alcohol 70% 1 bottle. E. Mercurochrome, 1 bottle. IV. Antiseptic lotion Dettol versus Savlon 1 bottle. V. Vaseline lubricate rectal catheter in a small jar. V. Acroflavon with spirit 1 bottle. Edisons for internal use, as per standing instructions of state. I. Paracetamol tablets, strip or bottle to carry about 20 tablets. E. Rehydration salt packets 5 to 10 packets. E. Antispasmodics. IV. Vitamins. Other equipment in separate small bag. A small kidney tray. A small gallipot. Cotton swabs, 2 paper bags, one of which contains sterile swabs and the other contains clean swabs. Gauze pieces. Bandages, adhesive tape and swab sticks. Instruments such as scissors, dissecting and artery forceps. Oral and rectal thermometer. 2 ml syringe, disposable, with needles for I.M. injection. 1 file to cut the ampoule. Additional equipment such as listed below can be carried in the bag if need arises. Urinary catheters. Hemoglobin meter. All times. The community bag should be kept in clean areas without danger of being contaminated by the children or domestic animals. Clean or boil the instruments after use and replace it safely. Avoid unnecessary exposure while doing procedure. Secure the bag by often cleaning and cover it properly. The community bag placed on a clean surface or on a piece of newspaper or a plastic sheet. Remove the soap, towel and nail brush and wash the hands well. Open the bag and remove only the needed articles and close the bag. Carry out the procedure placing soiled swabs inside a newspaper bag for disposal by burning or any other suitable method. Fold used paper or plastic sheet with exposed side innermost and keep it in the outside pocket of the bag. Write brief note of the observation, procedure done or instructions given. Check the bag daily, washing hands before opening it and make necessary replacements. 7.4.3 Steps of procedure with community bag. Select a work area according to the convenience of the family. Place the bag in veranda on newspaper spread over raised surface not on the floor. Unbutton the bag of lower compartment. Remove hand washing equipment and wash hands properly. Remove apron from the bag and put it on. Remove the needed items from the bag and set on the newspaper spread near the bag for performing procedure. Perform nursing care procedure based on the plan following the scientific principles and the steps of the procedure. Receive the soiled swabs, dressings in the paper bag and dispose this paper bag by burning it. When procedure is over, wash hands with soap and water. Place the articles to the bag after cleaning. Fold used newspaper with used side inside and discard in the dustbin. Close the bag. Replace soap dish and hand towel in the outer pocket. Record your procedures and observation and instructions given in the family folder or health card. Check the bag daily and replenish the used articles for adequate materials. For use at all times. Clean the bag. Disinfect the articles once a week even if not used. 7.5 Recording and reporting. It is very important to record the nursing intervention done and the condition of the individual family after the visit. A brief note of the visit may be recorded in the daily diary during each visit. After coming back to the health center, you should write a brief note of the important areas discussed with the family. Demonstration of care and treatment given in the family folder or individual card. E.g., you may record weight and general condition of the infant and report general conditions such as onset of communicable disease, high-risk mothers, or children needing special care. Referral to the medical officer in charge of the health center. 7.7 Summary. This practical has provided you with the necessary information and practical points for planning and conducting a home visit. We have talked about the indications for a home visit, the equipment required for a home visit and how to prepare the public health bag. During home visit you should encourage the family to participate, ask questions, provide information, demonstrate care and teach relevant health messages. Record the visit in the family folder. Discuss with the health worker about the strong and weak areas and future plan of visit. Thank you.